Hi everyone, I'm going to talk about the functional vision screening assessment of a 14-year-old child with spastic diplegia. Spastic diplegia is a form of cerebral palsy that is a chronic neuromuscular condition of hypertonia manifested as an especially high and constant stiffness or tightness in the muscles of the lower extremities of the human body, especially the legs, pelvis, and hips. For the introduction, cerebral palsy affects the motor area of the brain's outer layer, which so-called the cerebral cortex. It is part of the brain that directs muscle movements. So people who have cerebral palsy affects body movement, muscle control, muscle coordination, muscle tone, reflex, posture, and balance. It can have also infant and fine motor skills, gross motor skills, and oral motor functioning, which is caused by the brain damage. Spastic cerebral palsy, it is a common type of cerebral palsy. Spasticity is a form of hypertonia or increase in muscle tone. People who have this may feel stiff, movements may look stiff and jerky. Three forms of spastic cerebral palsy. First is spastic hemiplegia or hemiparesis, spastic diplegia or diparesis, quadriplegia or quadriparesis. So, as you can see in the image, orange represents less affected area and red is the more affected area. In diplegia, the more affected area is the lower limbs and the upper limbs is the less affected area. For hemiplegia or hemiparesis is one side of the body, the upper and the lower limb is more affected. And for the quadriplegia, both sides of the body, upper and lower limbs is most affected. So means that quadriparesis is the worst. Spastic diplegia, also known as diplegic cerebral palsy, is a form of cerebral palsy that is a chronic neuromuscular condition of hypertonia and spasticity manifested in especially high and constant tightness and stiffness in the muscles of the lower extremities of the human body, those of legs, hips, and pelvis. So the previous intern was able to observe and did 3 vision therapy to the patient. He did the pursuit, saccadic, and convergence. Pursuit, which is following the object, he observed that she has tendency of moving her head although she tries not to. And for saccadic exercise, she has to be reminded that she is being shown an object. And for the convergence, pencil push-up, she can fixate the object as near as 6 cm but loses her focus instantly. And now for the second session, which is the same skills, the pursuit, saccades, and convergence. For the pursuit, she doesn't move her head as much as before in the first session, and for the saccadic, she get tired with this activity and didn't cooperate as much. And for the convergence, she tries her best to focus on that pencil, but still she can't and loses her focus. For the third session and last, uh, for the pursuit, she is more cooperative during this third session. She did better following objects than the first and second session. And for the saccades, she is bit faster in jumping from one object to another, but she gets lost and has to look for the object again. And for the convergent, she cannot focus during this activity and seems to get tired. For the summary of the patient data, patient name X, age 14 years old. She's with cerebral palsy, which is type of spastic diplegia. An old RX of 5 diopters at the right eye and 4 diopters at the left eye. Her VA with her prescription is 20/160 with the Leia symbol at 1 meter. And for the near using the Leia symbol in notation is 5M. She cannot stand up alone. Tremors in her hand. She has involuntary rapid movements on her right eye, having hard time to following the objects without moving her head. Visual memory is good with the 3 object. Scanning is good. Shift gaze is slow. Pupil constrict when using the NPC. So for the discussion, so since the patient was absent for the first week of my rotation, I could only meet her twice in the second week. So I did visual screening and few visual exercise to the patient, which is most of the activity is in sitting positions since she cannot stand up alone. And I managed to get her visual VA with her prescription glasses. For the first session, I worked together with the PT since the PT wants her to stand up and correct her posture. So I did first her focusing skills with the use of a triangular shape. So while the PT let her try to stand up, I asked her to fixate at the object at a distance of 1.5 meters. So for the observation, while she is fixating at the distance, this helps her posture to be correct and find her balance when she tries to stand up. But she couldn't not really maintain it for a long time and since to get tired. For the hand-eye coordination with the different sizes of boxes in different color, and this time she was sitting, I placed the different boxes in front of her and asked her to arrange it from smallest to biggest. And for the observation, when she's doing the activity, she tends to go closer to the table. She could arrange the object, but the pace was slow and get confused after some time and need assistance, but at the end, she can still complete it. For the tracking, I use the circular object still in sitting position. I asked her to follow the object that I showed her with a distance of 1.5 meters without moving her head. She follows the object but with the head movement, and the pace was slow and sluggish. And lastly, for the shift gaze, using the two colored object, I asked her to look at the object by the shape that I would tell her without moving her head at the same distance of 1.5 meters. Still, she needs to move her head and she can shift her gaze from an object to another. For the second session, I work after the PT, and this time we only have the lesser time. So, first, I did again her hand-eye coordination with using the same object, and she still need to arrange the boxes from smallest to biggest. And for the observation, she still tends to get closer to the table while doing the task, and the pace was still slow and still get confused at the middle of the activity where the boxes are almost the same in size. She still need assistance, but she can still finish the task. For the second one, still hand-eye coordination with focusing. So this time she needs to insert the three objects into the shoelace. So for the observation, at first she is having hard time in inserting the first object, but she tries to fix the tip of the shoelace and insert it again, which she did, and it's a bit easier for the second and third object, and she finished the task with a time of 3 minutes and 20 seconds. And lastly, for this session is the visual sequential memory using the same object with the flat shoelace and three objects. She needs to arrange the objects that I used to show her. So for the observation, her visual sequential memory is good. She is able to arrange the object correctly by the color and shapes that I showed her. In my last week of rotation, I could only meet her once, and where I did my last and third session to her. So I worked together with a PT, which the goal is letting her stand up again, and I did 5 visual skills to her. For my third session, I did first the fixation with a triangular object and with the distance of 1.5 meters. While she is standing up, she needs to fixate the object. For the observation, she is now more cooperative and she can fixate a bit longer compared to our first session. And for the second, scanning and visual memory with the 4 objects, I present it in front of her with the same distance, and she needs to point the object that I will tell her. And for the observation, she will observe and scan first the object before she can point. Her response is slow, but she can point the correct object. Next is the shift gaze. Using the same object with different color at the same distance again, I will let her look the object by the colors that I'm going to tell her. Her response is still the same on my second session, not so slow, but it is good. And next is laterality. So using the popsicle sticks with the different colors, she needs to point the color that I will tell her, and she needs to use her hand that I want to use, that I want her to use. So her laterality is good, and she gets confused after some time. Last is the hand-eye coordination with the same objects, and she needs to arrange it from smallest to biggest. For the observation, she is good at first, but still get confused in the middle, where the boxes are almost the same in size, but still she can complete the task. For the management and recommendation, she should continue her visual therapy with the PT and OT to improve her visual skills, especially her visual memory, and continue to wear her prescription glasses, and should always have regular visit to her eye care specialist.